This episode of Distraction is sponsored by Landmark College in Putney, Vermont, home of the Landmark College Institute for Research and Training, working to discover innovative strategies and practices to improve teaching and learning in the field of learning disabilities. Learn more at lcdistraction.org. Landmark College. We teach differently. Hello, and this is Dr. Ned Hallowell for the podcast Distraction. I have a question that a listener sent in that I'm going to read to you and then do my best to respond to it. So here is the question. Hello, I have ADHD. I'm 58 years old, and I just found out I have it a couple of years ago after struggling personally and at work. I've been divorced twice, and looking back, I can really see how the ADHD took its toll on those and many other relationships. It is also really having a negative impact at work. I am a director of a small office, and my employees are really getting frustrated with my inability to perform my executive function role as the office executive. Is there any point in trying to educate them about my condition? Or should I just try to do everything I can to learn how to get organized, set priorities, tackle procrastination, deal with emotional upheavals, etc.? I know they think I'm incompetent and think I don't care, and so forth. I don't think this is true, but I'm really struggling to turn things around. I even started medication, even though I'm very wary of pharmaceuticals. It's helping with my focus a little, but I know that pills are not skills. So, what to do? Oh, what a wonderful question this is. You touch on some very important matters. First of all, I would try to have a meeting. If it's a small office, you all work together. I'd try to have a meeting with the folks who work with you and just lay your cards on the table. Say, I really am trying very hard. And although I usually advise people not to disclose they have ADHD, just talk about the target symptoms. If it's a small office and the way you describe it, it's so classic ADD, I would go ahead and say, I have ADD, but guess what? That doesn't mean I'm incompetent. And I'm working very hard to get good at what I'm bad at. And if you can help me with that, then I can help you even more develop your skills. So if you can sort of say, I want to kind of create in this office a we help each other out ethic. And that includes helping me out with my executive function, and it includes me helping you out with whatever I have in my skill set that can help you. And sort of say this is a program for all of us to get the best out of each other by helping each other so that everyone is doing what they're good at as much as possible. And having other people do what they're bad at, again, as much as possible. So I'd sort of frame it that way. So you're having a meeting of the minds of everybody so we can create a culture where we're not blaming people and saying you're incompetent or you're bad. Instead, we're trying to help people because we're all in this to make the work go as well as it possibly can for everybody. And then in that context, you can say, there's a word for this. It's called ADHD. Most people don't understand it. If you want to learn more about it, read Hallowell's book, Delivered from Distraction. And the way he phrases it or looks at it, it's not a disability but a trait. And if you manage it right, it actually becomes an asset. So to manage it right, I'm looking to get your help, and I'm also getting help for myself. So that's how I would approach this in terms of what to say at work. And again, my usual advice is not to use the term ADD because people so often misunderstand it. But in this case, it's a small office. It sounds like these people could understand, and you might as well use it because it's pretty classic. And you also educate them as to what it is and to what it isn't. And it has nothing to do with your motivation, and your skills absolutely could improve. Now, you say pills are not skills, but the medication, when it works, absolutely can make you able to develop those skills. It's like eyeglasses. When you get the right eyeglasses, you can read a whole lot more effectively. It doesn't give you the skill of reading, but it allows you to use your ability to read far more effectively. So make sure you work with your doctor to get the maximum benefit out of the medication. It's the easiest intervention we've got. done properly, it's very safe and can be extremely effective. It is not the treatment by any means, but it's a powerful tool in the toolbox. So make sure you're getting the maximum mileage out of the meds. You say you're wary of pharmaceuticals. Of course, everyone should be wary of pharmaceuticals. You can do damage but used properly, they're very safe and very effective. Just make sure you're seeing a doctor who really knows what he's doing. Thank you. That's a wonderfully interesting and very far-reaching question, and I was glad to be able to answer it. Please, listeners, send us these questions. They always contain points that other listeners would love to hear addressed, as I'm quite certain this one did. And also, if you have any questions about women and ADHD, we're going to do a special episode on that coming up, and we want to get your questions to incorporate them into that episode. So if you have any questions related to women and ADHD, menopause and ADHD, women's version of ADHD, is it different from men's? What happens to women in relationships with ADHD? What happens to women in the workplace? Whatever questions you might have pertaining to the big topic of women and ADHD, please send your questions. You can send them to connect@distractionpodcast.com. That's connect@distractionpodcast.com. You can send them by email or a voice memo. Please send them in. It'll make the show so much better if we are able to incorporate some of your questions. And again, we're part of a growing community where we are getting bigger and bigger. Please rate us on iTunes. Please talk us up. I really want to see this community grow into the vibrant, powerful influence it can and should be. This is Dr. Ned Hallowell. Thank you very much from Distraction. Distraction is produced by Collisions, the podcast division of CRN International. Collisions, podcasts for curious people. Our sound engineer is the brilliant Scott Pearson, and our producer is the incredibly creative Sarah Gurton.